6:20 in Trinidad and Tobago as we welcome you to the first of our interview segments on this Thursday morning. Thanks very much for joining us. Well, as many of you would be aware, there are a number of vacancies in the public sector when it comes to the health facilities in Trinidad and Tobago, and it's prompted a planned trip to Cuba later this month by the Health Minister Terrence Deyalsingh. The opposition has accused the government of deliberate underemployment of local doctors and nurses. We've heard from a medical professional himself, Dr. Tim Gopi Singh, with his own concerns and so on. However, the minister maintains that they are unable to fill the spots locally. Well, we're joined now by the health minister himself, and as you would be aware, there are so many issues on the table when you're talking the health sector that the doctors and so on situation is an important one, yes, but it's just one of the many issues we hope to cover with the health minister this morning. Thanks very much for joining us, sir. Good to have you with us. Before we deal with the doctors and the CDAP thing, the crab meat situation, what is the story with this facility in Santa Cruz with the stabbing and so on? What is the story with the Couva Children's Hospital?
Okay, so the Couva Children's Hospital, first of all, it is not a children's hospital, it's a hospital.
But the government that built it referred to it as a children's hospital.
For public relations purposes. The configuration of the hospital is 80 children's beds and 140 adult beds.
All right, let's move past that. Okay, it's a hospital.
It's a hospital.
Why it ain't open as yet?
2, it was a construction site under Shanghai Constructions, with UDCOT being the project manager until July 2017, which is just 1 year ago. When it was opened by the UNC on August 14th, 2015, 2 weeks before an election, it was shut down on the same day. It was never opened to the public because it was a construction site. It was an incomplete facility. We inherited a facility for which there was no funding, for which there was no staffing plan. It was handed over in July 2017, that's when construction finished. So we could not have used it prior to that. Since that time, the Prime Minister himself and I am on the record as stating that we are concretizing a partnership with the University of the West Indies to utilize that facility. The latest cabinet note I have to do that is before the cabinet this morning. Once, if and when the cabinet allows me to talk to the public about it, I will say exactly what is in the cabinet note moving forward to operationalize the facility under the auspices of the University of the West Indies.
Fair enough, and thanks for that clarification.
No problem.
Yesterday, in referencing works that are to be done, you highlighted Point Fortin,
yes,
Arima,
yes,
and another location.
The new central block in
Correct.
Port of Spain, which has to be replaced because there was a seismic report since 2009 for Zero that states that the central block in Port of Spain should be replaced.
Yeah, I know you mentioned that, but
right.
the reason I bring it up is that...
So those are more opportunities.
Right. So that requires funding, doesn't it?
Correct.
So you're finding funding for that, but you're not finding funding for the Couva one?
No, we are finding the funding for the Couva under the auspices of an arrangement with the University of the West Indies to operationalize the facility. We have to find funding for all of these facilities for Zero.
My final question on this topic. With all the explanation and so on, isn't this just an elaborate and very articulate way of just hiding the fact that this is nothing more than political bad mind?
No, I totally disagree with you. It's not often I disagree with you, but I most vehemently disagree with you. As I keep on saying, 3 times here for the morning, it was a construction site until July 2017, which is just a year ago for Zero. Please understand that. And let's not mislead your listeners. It was a construction site.
But in other words, it was completed and handed over more than a year ago.
Yes. And what we have done in that time was work through very serious issues with the university to get them. Remember, this is both new to them and us. But I'll tell you something. When this succeeds for Zero, the university running a hospital in Trinidad has the potential to significantly change the practice of medicine in both the public and private sector. Because now you have a teaching facility running a hospital. That will do wonders for the level of care. It will do wonders for the professionalism of our locals, because now foreign partners are coming down, exchange of ideas, exchange of technology. This has the potential for Zero to significantly change the medical landscape in Trinidad and Tobago. And I hope I get your support based on facts.
Well, indeed. I would love to see when it actually
Great.
opens and we see it
Yes.
actually function. So
Sure.
we'll see how things go. Let's move to the issue of the situation with the
Sure.
doctors. Because we had former health minister almost endorsing what you were saying to the point of the issue of specialists.
Correct,
and so on.
yes.
The opposition has presented it in a different context, saying that there appears to be a clear case of ignoring those who are coming through the educational processes at UE and so
Sure.
on. Give us the perspective as you understand it to be.
So unfortunately, Dr. Tim Gopi Singh and Dr. Lakram Bodo, who is becoming Tim Gopi Singh's puppy, adopted a very unpatriotic
political
stance.
games when
Yes.
you throw that as well?
No, it's true. Because Lakram Bodo has the potential to be a very fair-minded person. Both the Prime Minister and myself have complimented him on the Parliament floor for being objective. However, he has joined forces with Dr. Tim Gopi Singh, who is a stranger to the truth on these issues. They try to paint it as a spite against doctors. Nothing is further from the truth. And you would have heard an independent expert in the form of Dr. Fuad Khan last night on this very station, sitting right there, advocate that what we are doing is necessary as a short-term measure because the country does not have the specialty areas residing here who either want to work in the public sector or exist entirely.
Right.
So what choice did he have as a Minister of Health?
He said he did the same thing.
He did the same thing. So that's why I find the statements put out by Dr. Tim Gopi Singh and Dr. Lakram Bodo, who I looked up to as somebody with some integrity. But unfortunately, he has aligned himself with Dr. Tim Gopi Singh, and they have become strangers to the truth. And the truth was exposed by Dr. Fuad Khan last night. That what the issue is specialties, but what Dr. Khan and myself, in my press conference, and what Dr. Khan said last night, everybody puts the blame on the Ministry of Health or the Minister of Health, but he clearly articulated a silent partner in all of this. What is the role of the University of the West Indies? They are a major player in this issue, and they have been silent. And yesterday in my press conference, I challenged the media to talk to 3 independent apolitical voices and get their opinion, so that this debate does not degenerate into a UNC PNM thing, because I did not want it to go down that road. And I said, 1, get Dr. Chandra Sarup, the president of the Trinidad and Tobago Medical Association, as an independent apolitical voice. Because she has confirmed to me that house officers can be trained in the private sector, where most of them end up anyhow, after you train them in the public sector.
Right.
Let's partner together. Let's share the responsibility, public and private, to train these house officers. That's a challenge. That's national building. The second independent apolitical voice is Professor Terrence Deyalsingh of the University of the West Indies, the Dean of the Medical Faculty of Medical Sciences. Where are their voices? Why are they silent? And Dr. Khan last night rightly called out the University of the West Indies because they have a significant role to play in this, in the graduation of specialists. And 3, I challenged the media yesterday, get a third apolitical voice in the form of Dr. Fuad Khan.
Well, we got him last night.
Great.
Right.
But notice how I labeled him.
An independent voice?
An independent
He's
apolitical voice.
He's a member of the UNC.
But he spoke last night as a former Minister of Health, not playing politics with health like Dr. Lakram Bodo and Dr. Tim Gopi Singh. He came and he gave a very sober, expert view, saying he was faced with this. But the impression that Dr. Lakram Bodo, who I had high hopes for, and Dr. Tim Gopi Singh was given the public was this is a PNM spite thing from September 2015.
Right. obviously we are trying to deal with these
Sure.
issues at a rational, serious level.
Sure.
But let's just descend into the political dotishness for 60 seconds.
We must?
Yeah. If
Oh
you,
gosh,
no,
Fazil.
if you would allow me. Because in the same way that the...
1 minute you don't want me to go there, now you want me to go there.
No, for 60 seconds.
All right,
Because
Fazil.
no matter what you say, Minister,
Yes.
the UNC
No.
lunatics...
Correct. Dr. Tim Gopi Singh and Dr. Lakram Bodha.
I didn't say they were, but I'm just
Yeah.
saying the UNC lunatics in general will have a view. In the same way that no matter what you say, the PNM lunatics will have a particular view. How do you respond to those who will say that you are just presenting it in a lovely way when really is about PNM spiting Indians who are the majority of those who come out, churned out by UE as medical professionals, and only just victimizing them because all you know, most of them is UNC supporters?
All right.
60 seconds.
If there's a school teaching people to be cameramen, and you turn out 100 cameramen, are you obliged to hire 100 cameramen here?
No.
You answered the question already. If the law school churns out 1,000 lawyers, is the Ministry of the Attorney General obliged to hire 1,000 lawyers? Yes or no?
Not at all.
If the university churns out 1,000 civil engineers, is the Ministry of Works and Transport obliged to hire 1,000 civil engineers?
Nope.
Good.
All right. Well, the last time a minister asked me 3 questions, I was out of a job. The next morning, but anyway, let's leave it as it is.
And I answered it, and we did not descend into political
Indeed.
dotishness.
But how difficult is it in that sense when issues are always clouded in the public domain, social media, different radio stations, and so on, to get to that simple issue of the issues of specialist
Right.
situations not being
So
filled
what
and
has
so on?
happened, Fazir, in the public health sector over decades is that the shortages have always been at the specialist level. The doctors will come through their
Why
ranks.
is that? Okay,
But wait,
yeah,
so I'm coming.
yeah. Why is that?
The doctors will come through their ranks, intern, house officers, specialist medical officer, consultants, and so on. There are 2 main reasons why the specialists leave the public sector. And it was said clearly by Dr. Khan last, and I agree with him. 1, they may not always get the opportunity in the public sector. That is a fact. And 2, working privately obviously is more lucrative.
Although he did say that many of them prefer to work in the public sector
Yes.
because there are more opportunities
Yes.
to do surgeries,
Right, correct.
which is what they'll enjoy doing.
They want to
They
do
want
that.
to do.
And we are trying now to give them those opportunities. So for example, with the cataract initiative, where we are doing cataract surgeries more and more, they can get to practice and keep their knocks in. But there is still this inherent shortage of specialists. And the 11 areas we want to tackle, one correction, I am not going to Cuba.
Okay.
A team from the Ministry of Health is going to Cuba.
Okay, cool.
I probably misstated it in my press conference yesterday. Let me just clear that up. We are looking, in my effort to bring down infant mortality rates even further, although we are doing fantastically well, we need more pediatricians. We need more cardiologists. We need more gastroenterologists. Hematology is a big issue in Trinidad and Tobago. Blood, the medicine of blood, big issue.
Yeah.
We don't have enough hematologists. We don't have enough nephrologists. Fazir, we have an explosion of high blood pressure which ravages your kidneys. We need nephrologists by the scores. Internal medicine, orthopedic surgery. Please, we are opening a new orthopedic wing in Grandi. If there are any orthopedic surgeons in the public sector who want to do plenty operations, Grandi is the place for you now.
But wouldn't you be frustrated by the same issues that would have been highlighted before?
We are fixing those things now, Fazir. We are fixing those frustration points.
So why don't you deal with it at that level by the same thing that you're saying
but
now?
You fix
Call
it,
on those individuals.
You fix it, they're not going to get an influx now.
Right.
There's going to be a lag time, right? Maxillofacial surgeon. There's a global shortage of maxillofacial surgeons. Many of these specialties, Fazir, there are global shortages of it. So we are competing with first world countries and other countries for these same things. Ophthalmology and accident and emergency physicians. We need those specialties. There are global shortages for these. And we are competing with the United States. Look at England. England's medical system is buttressed by who? Doctors from the European Union.
Yeah.
right?
And from other parts of the world as well.
Exactly. So this is a global competition, a global space that little Trinidad and Tobago. So whilst we fix the systems to make it more attractive, while UV gets its act together, there is going to be a lag time of a couple of years.
And hence the Cuba alter.
Exactly.
But you just talked about it. Fix the system. Can you really fix this system?
Yes, you can. Yes, yes. We have started. Fazil, if in Trinidad and Tobago, in the space of 2 years, although you may be loath to admit this, we could get maternal mortality rates down to first world status in 2 years. Why can't we fix these things? And we are fixing it.
Okay, so
this Ministry of Health brought maternal mortality rates down to first world status in 2 years. We have brought infant mortality rates down to first world status in 2 years. Why can't we do that? And we are doing it.
And I wouldn't be loath to admit it. If you present me with the facts, I'll acknowledge it.
But I will congratulate the Express. The Express is the only media house that recognized by way of an editorial what we have accomplished with maternal mortality. I must compliment the Express.
Fair enough. But as far as this particular situation, the present circumstances of the health sector, at the end of the day, Minister, it's how the average citizen, not the person who could afford specialist care, who could afford private thing, who could afford to fly to wherever.
Sure.
It's the ordinary citizen coming off the streets, going to Port of Spain General, going wherever. Are they experiencing an improved situation, or are they told you're diagnosed with cancer, your next appointment is in 6 months' time?
Okay, so let's take the same cancer thing. You carried a clip last night. For the first time in the history of this country, we did a pap smear initiative at North Central Regional Health Authority. First time in the history of this country where we did pap smears of 500 women. And of those 500 women, we caught 9 women with first-stage cervical cancer, who, if we did not do that initiative, would not have known they had cervical cancer. And most of the doctors tell you when people present with cervical cancer, it's stage 2 and 3. We caught them at the embryonic stage. That is primary health care. Look at the cataract initiative. When I go to when I walk in the street, people are thanking me now that they could get their cataract surgery literally on demand in a space of 1 or 2 months. Because we have put systems in place, we have given the doctors the facilities, the same facilities they want, we have given it to them, and now they are performing cataract surgeries like it's going out of style.
We just have to go to a break, but in response to what you're just saying, which sounds very encouraging, why is it that doctors don't want to come into the system, especially? But I'll give you the chance to respond.
Sure.
Let's take this break very, very quickly. Coming up towards 6:38 in Trinidad and Tobago, because there are many more issues on the table that we want to touch on, apart from just the doctors' matter, but we'll be back right after this break.
I don't know how this thing get inside me. Mama every morning is driving me crazy. Like the taking me for a barnyard. Morning and evening, Uncle Farrell gone mad. If I don't want to sing, when he start to do his thing, I don't want to, but I gotta sing. If I don't want to dance, he does have me in a trance. I don't want to, but I gotta prance.
6:40 in Trinidad and Tobago. See, I know your Calypso.
Yeah,
the mighty
Shadow. I'm a constituent.
He's your constituent?
He lives in Mount Hope, my brother.
Okay, that's good to know. Well, indeed, of course, originally from Tobago, where the
Correct.
Prime Minister still is at the moment. Before is he going to be here for cabinet?
Yes, he's here for cabinet this morning.
Here, and of course, there's retreat tomorrow. So that is taking place as well. But let's get back to the discussion. You mentioned a lot of encouraging things happening in the health sector. Why then is it still difficult to attract locally based and qualified medical practitioners coming out of UWE or those who have specialized internationally in other places? Why is it difficult to attract them to the public sector?
Well, several reasons. One, we don't produce enough specialists. And the University of the West Indies that Dr. Khan referred to last night, they have a serious role in this. And I must say, they stepped up to the plate a couple of years ago, and they launched a series of specialist programs, DM programs. They launched a DM program in radiology, a DM program in anesthesiology, a DM program in oncology, but that will have a lag time. Because if the program starts in 2016, 2017, those programs are 2, 3, 4, 5 years. So it will be in a couple of years you start them coming out. Then they have to get the experience to work in both the public and private. So there will be a lag time. So clearly, as Dr. Khan and I are saying, you have no choice as a stopgap measure in the short term, but to source your specialists from outside.
I know we want to talk about the CDAP thing,
Sure.
the crab meat matter, what went on in Santa Cruz,
Sure.
but I have to ask you, and I know it's a difficult situation because people continue to ask themselves, how come it is in Trinidad and Tobago that you have so many private medical facilities popping up all over the place? And people in the public sector are left waiting for long hours or whatever. Even though you say it's improving, it is not ideal. It is some distance away from ideal. Is there anything you can do?
Sure.
Because, for example, correct me if I'm wrong, in a place like Canada, there is no such thing as a private medical facility.
Right.
Because
But there is waiting. And I could give you a personal
I know
example.
there's waiting.
Hold on.
Okay.
Hold on. I recently came from Canada. I went
Okay.
to visit my sister.
Right.
Do you know how long it takes to get an MRI there?
How long? 4 weeks, months?
Months.
4 months.
She had to wait 4 months for it. You see, people think it's only in Trinidad these things happen. The answer
But
is
at
no.
least they don't have a private sector that you could accuse
so we
of deliberately undermining the public sector.
Well, I won't say it's undermining. We have
Well,
a
no, I am raising that issue.
We have a constitution. People are free to open their it's a business, right? However, what we are doing now, one of the main sticking points for the public, one of the main frustration points for the public is our accident and emergencies. We have started to strengthen our A&Es, both in terms of physical capacity. We did serious work at San Fernando. Works are beginning in Port of Spain and Eric Williams. Our A&Es in a matter of months are to become much more effective, much more efficient. In addition to that, we are now training the human capacity. That is what we never invested in. You could invest in machinery, but what about the human capacity to run systems, to run processes? So via the United Nations Development Program, we have a $1 million training program now to train our executives and our managers in hospital management. Because Fazir, if you want a job in a hotel in Hilton or Hyatt, you know what they will ask you for? A degree in hotel management or a degree in hospitality. We don't have lettered people running our health system because they don't exist. Just as the specialists don't exist, they don't exist. So what are we doing? We have now invested $1 million to train all 5 RHAs to run their hospitals so that the patient could have a better experience over and above what we are giving them
But just
now.
finally, and I know, you can't comment on things we don't know, we can have just speculation
Sure.
and so on. But is it a challenge if you have medical professionals and so on preferring to work in the private sector because it's more lucrative, it's more convenient and so on? Doesn't that impact upon the ability to service and provide for the public sector?
I will be foolish and dishonest if I said no. The answer is yes. But we have to work around it, and that's why we have to go to Cuba.
All right. Let's deal with some of the
Sure.
issues on the table. CDAP. What's the story with
Okay,
that?
so for Zee, you'd have remembered about a month and a half ago, we announced some changes to CDAP to benefit the patient.
Yeah.
And at that time, there was sound and fury. You had people running around saying that the CDAP will collapse because we reduced the dispensing fee from $8 to $10, from $10 to $8. I can tell you with a sense of pride and duty to the public that since we have reduced the dispensing fee and since we have started to distribute drugs more often, because prior the contract stated we had to distribute drugs once every 2 months. With the changes and the redirection of resources, we are now distributing drugs every month. We have reduced the dispensing fee, so the monies we save there, we put it into drugs. More drugs, more distribution. But
what about the quality though?
I'll come to that. Let's deal with the mechanics. I'll come
Okay,
to
sure,
the quality. And there was sound and fury that pharmacies are going to opt out and the patients wouldn't dare. Do you know how many pharmacies have opted out?
None?
None, as predicted. As predicted. We said that any new pharmacy that wants to come into the system should pay the setup cost of $68,000. We were told, and people went around, oh, no new pharmacy. Do you know how many pharmacies have signed on now? 5.
5.
So the program and the changes are working for the benefit of the citizens. So your grandmother who might want CDAP, it is working for her.
And in relation to, the system business,
Yeah.
what about the quality
Right,
of the medical? Because there may have, some people, they go to one place, the medication, the same name or same generic name, but one time it works, another time it don't work at all. It's like like sawdust.
All right. Let's be careful how we talk about CDAP and generics. I take generics. There's nothing wrong with approved generics, approved by the Food and Drug Administration, European.
Is that functional, the Food and Drug Administration
Yes.
in Trinidad and Tobago?
No, FDA in the United States.
Because what about our Food and Drug Division?
Yes, remember I inherited a mess there. We are fixing it.
It is not functional right now.
We have to redo the building. That is almost completed. And
So it's not functional right
it's
now?
not entirely functional, but that does not mean testing is not taking place. We send it to other labs. We send our testing to Jamaica, Barbados, UE, Kariri. So testing is taking place.
Does that leave us in a vulnerable situation?
No, because testing is taking place. If we had no testing, then we were vulnerable.
So you're saying that nothing that is being dispensed in Trinidad and Tobago gets by the testing procedure?
No, hold on. Not all drugs registered in Trinidad and Tobago are tested locally. You don't do that.
No, actually,
You
but I
accept-
mean, if they are tested, if they are tested anywhere,
Yeah, they can be tested.
Yeah.
That's not a problem.
Right.
So on the issue of CDAP drugs,
Yes, and the quality and the generics and
there
so on.
is nothing wrong with generic drugs. However, I stood up in the parliament and I said categorically there were 2 drugs I was concerned about, one for diabetes, one for hypertension. As a matter of fact, the Express carried a full-page article on the following day. And I gave the country the commitment I will take these 2 drugs off the CDAP. I did it, we did it, and we put on 2 substitute drugs. Whenever a claim of any drug, whether it's CDAP or anything else comes up, we act. Right? So currently, I have no problem with the quality of the generics on CDAP. We had a problem with 2, we acted, we took it off, and we replaced it with 2 more.
And you are satisfied that the system as it now operates is functioning as best as it can, given the existing...
The system has, with the changes implemented in July 1, you are starting to see the results of those changes. We expect within 3 to 6 months, you will see the full, it takes time to work through the system, right?
Yeah. Let's move to the crab meat
Sure.
matter and the whole issue related to that.
Sure. So with the crab meat matter, there was an advisory put out by the US FDA that we should not be eating crab meat from Venezuela. We did our due diligence. What we found out, there was one import of crab meat from Venezuela for a small amount in 2017. Since then, there has been no more imports, and I got this from the Minister of Agriculture, for crab meat from Venezuela. So the threat disappears and recedes with each passing day. However, we at the Ministry of Health, we have a duty to protect the public's health. So what we have started doing within the past 2 weeks is doing sampling. We have collected about 23 samples of crab meat throughout the country, both tin crab meat and live crab meat. Those 23 samples are currently being tested for that particular bacteria, which is related to cholera. Once we have the results of those tests, because you have to get the samples, put them in a culture, grow a culture, tra-la-la-la-la.
Right.
I expect to have those results within the next day or two. We will make those results public.
And if the results come back negative,
we'll tell the public the results, yea or nay, positive, negative, to be worried, not to be worried.
So at the moment, it is not. It's on the banned list. The crab meat from Venezuela.
Yes, yes.
So in fact, there should be nobody selling that on the shelves in Trinidad and Tobago.
Correct.
You sure you're not doing the dirty work of the Americans who are just looking to victimize Venezuela for everything?
Well, as somebody charged with maintaining and protecting the public's health, we have to be careful and take these advisories seriously, whether they come from PAHO, US FDA, European medicines agencies. We have to, because if I didn't do it for you, then you know what you will call me here for?
You alive.
And you slaughter me.
Yeah, absolutely.
I can't win with you for zero.
No, you can't. It's as simple as that. And the other matter, a very, very serious situation in Santa Cruz with the attacks that occurred at a home, and when people were asking a lot of questions about whether this facility is approved or regulated and so on.
So what we uncovered was, one, the facility is not approved. It does not fall under the responsibility of the Ministry of Health, either under the Mental Health Act or the Private Hospitals Act. However, that does not mean we don't have a duty of care, a moral responsibility.
Sure.
So what we have done for Zero, we sent in a team from the Ministry of Health under the generalship of the acting chief medical officer who personally visited the home. We have sent in a team from the Northwest Regional Health Authority because it falls under their thing. And what we are doing, instead of applying the law punitively, we are applying the law compassionately, and we have given them a list of things to do to bring their home up to spec to qualify under the Mental Health Act, and so they can be brought into the legal framework and run a home fit for purpose. We are advising them on everything from medical storage, medicine administration, cleanliness, sanitation, that they need to have a doctor on board. And so far, they seem willing to comply. But if they don't comply, then we will act on them and do the necessary. But I think in the first instance, we need to apply the law, as I say, compassionately rather punitively. And we are giving the home the opportunity to regularize their practices so that they could be legally registered.
And okay, I take your point about the compassion, although some will say that Trinidad and Tobago is too much of a blight country where everybody's got a blight.
They would have gotten a blight if we had turned a blind eye to it. We have not. We have told them in no uncertain terms, if you don't do A, B, C, D, and E, you will be prosecuted.
Have you been giving them a time frame to reach
the chief medical officer will be handling those details.
Okay.
I just give the general.
But how would you respond then in this particular case to say, well, look, when it comes to matters of health and welfare, whether it be mental illness or any other, that there should be no compassion in that sense, that there should be an insistence upon standards, whether you call them first world standards or Caribbean standards, whatever that there should be an insistence on that and no negotiation.
So that is why when this issue reached its head, we insisted that they comply, that they do X, Y, and Z to comply. That is what we are doing. I fully agree with you that the law has to be applied, and we have told them unequivocally, if you don't comply, this is the consequence. Because this is too serious a matter to leave up to their whims and fancies.
How-
And like all hospitals under the Private Hospitals Act that we monitor, they will also be monitored.
And because we just have a few minutes left,
Sure.
just as an overview, Minister, because you've highlighted a number of advances, as you mentioned, the Express would have acknowledged it, and indeed the mortality rate, the infant mortality rate.
And maternal.
Maternal, sorry, that
And
is a
also,
significant
this is
achievement.
the second year in a row we have had no one dying of the influenza virus.
And
Since
again-
2009, because we have ramped up our influenza vaccine drive from 6,000 doses to 60,000 doses. That calls for investment in time and money. This is the second year in a row, first time since 2009, no one has died of the influenza virus. Those are significant accomplishments. So we are attacking on all fronts, but in a public health system, there will always be something that you could do better.
Right,
there will
but-
always be a need for more.
Correct, but are there too many in the Trinidad and Tobago
Yeah.
context, given the resources that we have had in this country, Minister, the qualified people, the educated people and so on, given the relatively small size of our country, are there far too many problems in the health sector that need fixing?
There are issues that have not been traditionally addressed that we are now addressing for the first time. And I don't want to harp on it. To bring down maternal mortality rates wasn't difficult, you know.
Then why is it so difficult to fix
Because
so many
no
of the
one
other
had the
things?
political will to tackle it.
Why?
But you have to ask those who went before me. No one had the political will to focus on bringing down infant mortality. No one had the political will to say, if people are dying from the influenza, and this country was only giving out 6,000 doses prior to 2015, give out 60
I just want to
and
ask
vaccinate people.
I just want to ask you one question.
That's political will.
Okay, just one question. Fair enough. Before we close off, in Trinidad and Tobago today,
It's a difficult question
No,
or
no,
easy one?
I don't think it's difficult.
All right, good.
In Trinidad and Tobago today, is there a better chance of you living or dying based on how much money you have, as far as public health, the health sector?
No, I would say no, because
So a poor person diagnosed with cancer this morning.
Oh, but let me finish now, brother.
All right, okay, go ahead.
When you look, the best way to answer that is statistically. Our life expectancy rates have been going up. So the best way to give it is that, and those statistics are easily available. The life expectancy rates for males have gone up by about 3 years over the past 15 years, I believe, from about 68 years to 71.5 years. The life expectancy rates for females has gone up, I think, from 65 to about 68. So the best way to answer you that is our life expectancy rate is going up.
But does that really answer the question as to somebody like immediately?
Well, I think the healthcare system, both public and private, will have a role to play.
Okay,
Right?
Minister, thanks very much
You're
for
most
joining us
welcome, my
this
friend.
morning. And as always, when it comes to issues related to health and wellness, there are a lot of issues on the table, and we've touched on quite a few of them, including the issue of the doctors, which was the primary reason for our discussion following the media conference yesterday. The news coming up, then we move into the second hour of Morning Edition on this Thursday.
Every morning, he driving me crazy.